Hello, my name is Quinn Throckmorton. I'm the Residency Program Director here at the University of Tennessee Campbell Clinic Department of Orthopedics. Thanks for taking some time to log in and learn a little bit more about our program. By way of introduction, I'm a transplant to Memphis. I actually grew up in Iowa and lived in California and Minnesota and some other places, but I call Memphis home.
Campbell Clinic's been around for more than 100 years. The residency program's been around most of that time, and it's one of the most important parts of who we are. So we take great pride in selecting the best and brightest orthopedic residents in the country, we think.
This is one of the original residency programs in the country for orthopedics. We've been doing this for over 100 years, and most institutions that have been around that long generally have a pretty good idea of how to handle things. But there are three principles that we think have really stood the test of time in this regard. First, this is a comprehensive residency. You see everything in terms of subspecialties at least twice. So whether it's hand surgery or foot surgery or shoulder and elbow, you see that first as a junior resident and then again as a senior resident. We know that you learn differently as a junior resident versus a senior resident. So by seeing it at different points in your training, that gives you a better exposure to the principles and your ability to apply them once you get into practice. Second, this is a high volume operative experience. Our residents average over 2,000 cases by the time they leave here, and we would put that up against anybody in the country in that regard. But we still feel like we have appropriate clinical training in the clinic, learning decision making as well. And finally, we stand very strongly on the idea of appropriate resident autonomy. In an era where the residency experience is continually degraded and resident responsibilities are diminished, we still believe in graduated responsibility. So as a junior resident, you are brought along to the point where as a senior resident, you're able to make your own decisions. And we feel that we graduate 8 well-trained orthopedic surgeons every year who are ready to make their own decisions, and they don't have to spend the first couple of years of their practice trying to figure that out.
So my name is Derek Kelly. I'm the Assistant Program Director here at the Campbell Clinic Orthopedic Residency Program. I'm trained as a pediatric orthopedic surgeon. I grew up just across the river in Arkansas, and the Campbell Clinic always had just such a prestige in the medical community. I was very excited to be able to join this practice. It is also wonderful to be in Memphis. Memphis is such a diverse and unique medical community. The resources that we have here between all the hospitals that we partner with, the infrastructure in Memphis from logistics, the Mississippi River, FedEx, the airport, it's a great place for even startup companies or well-established medical companies such as Smith & Nephew and Medtronic to have their international headquarters. So the opportunities you have across the full breadth of the medical field is really phenomenal here in Memphis. So as I mentioned, on top of that, there is a wide variety of hospitals here. We have Le Bonheur Children's Hospital, we have Regional 1, which is our main trauma headquarters. We have St. Jude's, where we have access to pediatric musculoskeletal infection and the whole breadth of hematology, oncology, and pediatrics. And then we have community hospitals, the private practice setting where patients can come for elective surgeries and even be admitted to the hospital. Memphis provides such a unique experience for residents and medical students in their training, starting all the way at the floor level of research and development for the startup companies, all the way up to the most complex patient care in our biggest hospitals. We have it all.
From a broad perspective, we really have 2 types of rotations. There are the inpatient rotations, and those are at the trauma center and the children's hospital and so forth. Those are team-based environments, meaning that you come in the morning, you round on your inpatient service, there's morning report where all the information is exchanged, and then if there's an in-house call team, then they go home, and then the team breaks up to do the work of the day, be it clinic or OR. The other type of rotations we have are your subspecialty rotations, where you are one-on-one with an attending surgeon, and that's more of an apprenticeship model. So if there are inpatients on your service, you see them in the morning, typically with your attending, and then wherever your attending is that day, that's where you are, again, be it whether it's in the OR or the clinic.
One of the great benefits of a program like ours, a program with our size, is the opportunity to learn from people with lots of different ideas of how things should be handled and managed. From junior residents up through fellows and up to attendings, you're going to get a wide variety of experiences and ways to treat things.
So when you see a new patient in my office, and that's typically how we do it, you'll see the new patients, you'll present them to me, and I'll say, okay, well, what would you do with this patient? I want to know what you're thinking, how you would handle that patient. There's not just one right way to handle a patient. In the operating room, your PGY-5, again, we expect you to be able to operate. It's more the resident, the way the staff with the resident interact, is I'm expecting you to be able to handle a lot of this without, as if I were not there, but at the same time, I'm there.
It's wonderful to be in a place like Campbell Clinic that draws talent from all over the country, all over the world. And our fellowship program is very robust. The residents have a very interesting interaction with the fellows. In some rotations, you may not ever see them. You're not going to find yourself stumbling over fellows for cases or fighting them for interesting clinic cases. However, in some of our big hospital systems, you will interact with the fellows and you'll get to learn from their experience, even from other institutions.
We're very proud of the legacy of leadership that we have here at the Campbell Clinic. We've had 7 presidents of the American Academy of Orthopedic Surgeons, 4 presidents of the AOA, and 7 directors of the American Board of Orthopedic Surgeons. And that level of political connectedness, if you will, really is just a priceless resource for residents because it opens doors and opportunities for them that they wouldn't get otherwise. We spent a great deal of time and effort over the last 12 or 15 years on our research program here, to the point where I would call it now a mature program. And we have fairly extensive infrastructure in place to support that mission. It all starts with our research nurse coordinators. We have 6 of them scattered around the clinic, and each of them has their own set of responsibilities, but they primarily include things like IRB and study tracking to make sure that studies stay online. We then have a librarian who's instrumental in literature searches. We have biostatistical support through the University of Tennessee, and then a very robust editorial staff. They're probably best known for editing Campbell's Operative Orthopedics, but they're also responsible for formatting and submitting our manuscripts. What this provides for the resident is a very focused research experience. You're not having to fight the IRB by yourself. You're not having to make sure every little reference is right in order to submit the manuscript. What you're focused on is formulating a good study question, working on that with your attending, then getting a hold of the data, analyzing the data, and learning how to write a good abstract and manuscript.
As an attending surgeon in a large residency program, I get to see lots of resident interactions. I work in one of the hospital settings, so I get to see the team approach. I get to see a number of residents working together on a day-to-day basis. And I can tell you that they really enjoy working together. They are always talking about the day, what the day is going to bring, how do we get this work done in the most efficient manner. It's really a strong team approach. And then the side conversations are about what they did over the weekend and how they're planning the next trip together, how they're planning the next gathering of their wives or their husbands and spouses. It's just been a wonderful thing to watch the residents interact and enjoy each other in this program.
The on-paper metrics like test scores and grades and letters of recommendation, all those are very important for us in terms of an initial screen. But at that point, what we're looking for is character. Residents are given a great deal of trust within our system, but in order for that to work, we have to have assurance that we're dealing with a high quality and trustworthy individual. So the candidates that are able to show that on the day of their interview, those are the ones that we're looking for, and those are the ones that we want to have at the Campbell Clinic.
And so when we look at the incoming interviewees and we look at them, we try and project how they might be in our program. We're really looking for people that have the same priorities that we have, and how because it's 5 years, they're going to dedicate their lives here, and we're going to spend time with them trying to train them. We don't make a decision without thinking about our patients, our employees, our residents. We make decisions to try and nurture those 3 groups of people along because they're the most important to us.
So it's really difficult in some cases to judge quality of residents when they leave the program. However, the one thing that I really hang my hat on is the fellowship directors that reach out to us and say, could you please send us someone else from your program? These are the most well-trained, hardest working surgeons that we've come across, and we want as many as we can get.
Well, thanks for taking the time to learn more about our program. We'd certainly be interested to learn more about you in this application process.